Okay, so we are back on again. We are back again, back again, back again. Hello, 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 hello. Okay. Let me set up my. Okay. Move over here. Put this like this. Okay. Let me bring you over here. I'm coming out. Say hello.
Okay.
Hey.
Look at you.
I'm coming out. Hey. I'm coming out. Y'all know Miss Harper silly. I know. Y'all know I'm silly. All right. Hello, 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 class. How y'all doing today? This is Miss Harper. Oh, I see y'all can see me in 3D and 2D. Okay, fantastic. Okay, so I'm going to talk about CPT codes and its variables of reason and how to find your exact code so you know how to code what you need to code, okay? Now, we're going to talk about evaluation and management, your E&M codes. That's the first set of codes in the beginning of your CPT book, okay? These are the codes that begin in the 99,000 series. Okay, and they have 3 different variables, sometimes 4 different variables. 4 different variables to define the code you need. Okay? Now, again, let me say this in all clarity. Okay? For your CPT book is for your procedure code. That means PX. PX. Okay? Your ICD 10 book tells about your diagnosis code. That's DX. Okay? PX means procedure code in abbreviation, and DX means diagnosis code. Diagnosis code. Okay? Now, and then I'm going to erase this in a minute. Now, procedure code tells what the doctor did. What the doctor did. Diagnosis code tells what is the matter with the patient. Okay? That's how that works. Okay? So, if you're going to work in a physician's office, you're going to need a CPT book all the time. And you're going to need an ICD-10 book all the time. Rarely you would use a HCPCS book, okay? Your HCPCS book is mostly used for durable medical equipment, feedings, and other home health stuff. Okay? Your durable medical equipment, feedings, and other home health stuff. So if you're working for a durable medical supply company, if you're working for a home health company, you're going to use these three books. Okay? It just depends. If you're working for a home health that deals with respiratory therapy, that deals with occupational therapy, physical therapy, you may have an LVN or RN that's going to go out and do feedings for that patient inside their trachea, cleaning out their trachea, or feedings by IV, or they're giving Ensure, and they got to check the patient's weight and do all these wonderful nurses' notes and stuff just to tell the home health agency what's going on with that patient, and then we would have to bill for it. So yes, you do have billers that work for home health agencies. Did you get that? Did you get that? Did you get that? Don't be so narrow-minded just looking for jobs at the doctor's office. It's a whole big world out there for medical billing. Don't be so narrow-minded. Hello? Broaden the mind. Open the mind. Okay, fantastic. Now, the different variables. So we're going to look at a scenario. I was helping out with one of my students, and I'm going to get that. So could you bring me that, sweetie? Try Bain. Bein. All low. Low. Let me know. You got it. Did you get in? What's that one? Yeah, and the top sheet. Thanks. Okay, great. Luckily I remember. Okay, so I'm just going to read this scenario here. It says a 16-year-old female is being admitted by her family practice physician. Okay, this is just a scenario with a 2-week history of fatigue and fever. It has been progressively getting worse. She is suffering from dehydration. The physician performs a comprehensive history to look for explanations for fatigue, including recent activity level and recent sleep habits. A detailed examination is performed and she is diagnosed with mononucleosis. Okay, so let's go back, and usually the way I examine this, I like to dissect, okay? And remember in grammar school when you had the 8 parts of speech and you find your noun, your verb, your adjectives, your adverb, your participles, all that beautiful stuff. Well, this is where grammar school come into play, okay? Now, a 16-year-old female is being admitted. That means she's not admitted yet. She's still at the doctor's office by her family practice physician for a 2-week history of fatigue and fever. It has been progressively getting worse. She is suffering from dehydration. Signs and symptoms. We're going to talk about that. Signs and symptoms. Okay? The sign is fatigue and fever. Okay? The symptom is sound like she has dehydration. The physician performs a comprehensive history. So let's write that on the board. That's a clue. Comprehensive history. All right. To look for explanations for her fatigue, including recent activity level and recent sleep habits. A detailed examination, we're going somewhere, pay attention, stay focused. A detailed examination is performed and she is diagnosed. We say that diagnosed does what? Tell what is the matter with the patient. Tells what's wrong with you. Oh, you got mononucleosis. Of course, the doctor ain't gonna tell you that. He's just gonna say, you in lay terms, you got some issues. That's blah blah blah. Okay. Now let me explain. These are two clues of variables that's going to help us define our CPT code in the CPT book. I'm going to step away and get the CPT book. Wait just a minute. Remember this beautiful book? Okay. Now, starting with this, you're going to read all your coding guidelines. You got to read all your coding guidelines in here. Okay. Every section of a CPT book, I said it before, has its coding guidelines. Do you see that? Evaluation and Management Services guidelines. Read your guidelines. Your guidelines will guide you to making sure that how you code and should code, or how you look at things to give a proper procedure code, will help you do your job well. It is your conscience in writing. Let your conscience be your guide in writing. Okay? Fantastic. Now, and it has a decision tree for new established patients. So it's very good. All right, so let's look at this. Let's start with new patient. Now, if this is a brand new patient, then we're going to start with a new patient. Okay? Let's go back to the scenario. The scenario says she is a 16-year-old female being admitted by her family practice physician with a 2-week history of fatigue and fever. Okay? Underline that. Did you hear that, Diana? She is a 16-year-old being admitted by her family practice physician with a 2-week history of fatigue and fever. Does that sound like she's a new patient or an established patient? No. No. In the doctor's office. She's in the doctor's office. She has been seeing the doctor for quite a while. The doctor noticed that she has a 2-week history. That means she has been to the doctor what? A time before, a visit before. So if that makes a patient that has come there once before and they're back established, very good. What did you say, Chris? Established, very good. Yes, sir, indeed. So you have to read the scenario. You got to pay attention to detail. That's real important in coding and billing. Okay. So with a 2-week history of fatigue and fever, it has been progressively getting worse. She is suffering from dehydration, signs and symptoms. The physician performs a comprehensive history. Okay, so we already know that by a 2-week history of fatigue and fever, she's been to the doctor at his doctor's office before. That says that she is a what? An established patient. So we're going to take our book here. We're not going to look in the new patient area. No. We're going to start looking in the established patient area. Do you see that? Established patient. Okay. Now, look at this. Right here. Hope you can see that. It says comprehensive history. On that page, look on your sheet. On that scenario, Diana. Does it have comprehensive history? Did he do a comprehensive history on her? Yeah, go back to that scenario. Go all the way up. Yeah. 16-year-old patient. Okay, so here, every procedure code has a detail of variables to judge by. And you're going to take those details and judge it accordingly. Okay? Now, 99204 is a procedure code that says office or other outpatient visit for the evaluation and management of new patient, which requires three key components. Four different components, or three different components, or three different variables, four different variables. It's the same terminology. It's just all about the connotation of how you use that word, okay? Now, so we have that. Check. Let's check that out. Comprehensive. Okay, we found that. Comprehensive. Now, let's look at another one. Let's see. 99204 says comprehensive. 99205 says comprehensive. Oh, wait, I'm sorry. This is still new. Okay, we're going under establish. Sorry. Okay, this is problem focused. This is expanded focus. This is detailed. This is comprehensive. Okay, now, comprehensive history. He has been doing a detailed examination. A detailed examination. Let's look at this. Okay. No. Okay, detailed examination. Problem focus examination. Let's look at this. Evaluation. Usually. Okay. We can go 99211, huh? Okay. Detail examination. Okay, very good. So 99214 has detail examination. However, we are still looking for comprehensive history. Okay, so we have, it says right here, the evaluation and management of an established patient, which requires at least two of these three components. Okay, and then you have comprehensive history, comprehensive examination, medical decision-making, high complexity. Okay, so we have detailed 99214 and we have 99215. 99214 has detailed history. It says counseling and or coordination of care with other physicians, other qualified healthcare professionals or agencies. Okay, professional needs, usually presenting problems to moderate, high complexity. Okay, this right here says comprehensive history, comprehensive examination, counseling and coordination with care and other physician, qualified healthcare professionals and agencies consistent with the nature and problem of the family needs. Usually presenting problems to moderate of high severity, typically 40 minutes. So we have 40 minutes, we have 25 minutes. Let's look at the scenario again. Now, 16-year-old patient is being admitted by her family practice physician for a 2-week history of fatigue and fever. It has progressively been getting worse. She is suffering from dehydration. The physician performs a comprehensive history to look at the explanations for fatigue, including recent activity level and recent sleep habits. A detailed examination is performed. Okay? So he's doing a comprehensive history, but a detailed examination is performed and is diagnosed. Okay, so he examined her, although he gave her a comprehensive history, and you can vary, it can be varied. You can go with 99214, or you can go with 99215. Okay, he gave a comprehensive examination, but a detailed history. I would go with 99215 simply because this is not the totality of that, but in that you have to consider her labs. There's her sleep readings. So obviously she had a sleep apnea, so he needed to interpret that, what the sleep doctor was saying. She's been to him been to him before, so he has to dig in a little deeper. So this is going to take about 40 minutes of his time. Do you see that? Now you have comprehensive down here, you have detailed up here. I would go with the most specific and the most that fits the scenario, the situation the best. And it would be 99215. Do you see that? Do you see the variables? Do you see how to judge that? Okay. Sometimes you can go with the 214, but considering the fact that the doctor has to read lab notes from another physician, lab notes from Quest Diagnostics or LabCorp, and also has to compare notes from the last visit, that's going to take him about 40 minutes. So we're going to use the highest specificity, the highest of the most, and do a 99215. And the insurance will pay for that. Okay? And that'll be it. And that's how you know. So you have these variables. Usually it gives more variables to work by for you to choose. Okay? For you to choose. All right. Now, let's look at the next scenario here. So did you write that down? Did you type that in? 99215? Okay, very good. Let's look at the next scenario. The patient is a 34-year-old established, here we go, established patient seen in the clinic by her dermatologist. She is followed by an extensive psoriasis involving her scalp, trunk, and arms. Okay. It has worsened and spread over her palms. She is now also complaining of joint pain, psoriasis. The spread to her hands has made it difficult to do many day-to-day tasks. A detailed history and examination are performed. History and examination. The examination includes inspection of infected areas in addition to bending and rotation of joints. A long discussion took place regarding a change in her medications to try to gain better control of her psoriasis and slow down her systemic progression. Topical and systemic treatment was decided upon. Okay, so you already have all this inside the soap notes. What was the plan of action? Okay, now let's dissect this. The patient is a 34-year-old established patient seen in the clinic by her dermatologist. She is followed by an extensive psoriasis involving her scalp, trunk, and arms. It has now worsened and spread to her palms. She is also now complaining of joint pain. The spread to her hands has made it difficult to do many day-to-day tasks. A detailed history and examination are performed. The examination includes inspection of the infected areas in addition to bending and rotation of joints. So established patient. So we're going to go under established. You got it? Yeah. Okay. So we're going under established. So let's look and see where she falls in that category. Okay. What do you see?
No, I don't see how you just get the variables to find what CPT coding is.
Yes, you got to compare the variables to find which CPT code to choose. Okay, so established patient. Now it says that she had. Where is that? A detailed history. So we got problem focus history 99212. 99213 says expanded focus history. That didn't say that in the scenario. 99214 says a detailed history. Is that in the scenario here? A detailed history? Do you see it? You don't see it in the scenario? Come down about 4 sentences. Kind of look to your right.
I see an examination form.
Yes, it says a detailed history. Look like 99214 says detailed history in one of the variables. Okay. Then it says a detailed history and examination. That's inclusive. So it was a detailed history and a detailed examination. We have two of the three variables. What is the CPT code for this established patient? 99214. Amen. Amen. She found it. All right, you go, girl. Okay. Now, Diana, do you think you're ready to do one?
Yeah.
Shucky ducky quack quack. She said, yeah. Let's get you to do number 38. Mr. Mackey, you want to challenge one? Would you like to challenge one?
Yeah.
Okay, cool. Okay, well, you can use this one. Okay, thank you. Thank you so much. Are you complete with everything?
No,
Why not?
some of it is.
Oh,
It
okay.
says, discussion, on discussion questions will be great.
Okay, so you need to work on it.
Well, I need the whole.
Oh, okay. Remind me. Okay, gotcha. Okay, give me a minute. Thank you. Okay. Do number 38, Diana. Number 38. I want you to read it and dissect it. Did you kind of glean what I was saying? How to dissect it? Okay, I want you to dissect it.
What do you mean number 30?
She's number 38. You're gonna be the next one. Yeah.
Oh, yeah.
Give you a little challenge. A little challenge. Okay, read it out to me. Number 38, Diana. That's you. Take the markers. You can use the highlighters. You can use my bag. Take the whole bag with you. All them beautiful markers. That's ExxonMobil markers. Did I say that on video? I'm sorry. It's my husband. He don't care. Let me see. Okay, so while my students are, did you find it?
Yeah.
Diana, what? Okay, tell me what did you find? Let me write this down on the board here, number 38. I got to see how you did this. I know you did good. I'm not worried.
I hope so.
Yeah, girl, you gotta build your confidence. Come on now.
I'm gonna need Jesus on this one.
Oh, you gonna need Jesus? Okay, baby. It's gonna be all right. He with you. He with you.
Number 40.
Okay, so you doing number 38, Diana.
Yes, ma'am.
Okay, tell me. What did you
The
find?
variables?
What are the variables?
The variables are a problem, focus, history, and examination.
A problem, focus, history, HX means history, and examination. Okay? And what else?
And a prescription is given to the reward before the reward is needed. The prescription is given to the patient.
Okay, so you got problem, focus, history, and examination. So you got problem, focus, history. And you got a problem focused examination. That's how we need to appropriately write it. Okay, now the prescription, that's something else. So that's not inclusive for finding a CPT code. Okay, that's not a variable. But you did good though. You learn it. That's what it's all about. You learn it. Okay. Now, since was the patient established? Was the patient new? Did they say that? Can you?
He's not broken, he's just visiting. And he is now there in the clinic and needing his medication.
Okay, he's what now again?
He's not from there. He's visiting his daughter.
He's visiting his daughter. Okay,
And now he needs medication.
and now he needs medication. Oh, he forgot his medication. He's seeing another doctor that he's never seen before, and he's on vacation. So he's a new patient to this doctor that's out of town from where he lives, right? Okay, so he is a what kind of patient?
A new patient.
A new patient. Say it again, girlfriend.
A new patient.
Whoa! Okay, so what is the CPT code? Did you find your 2 out of 3 variables?
99201.
99201. Okay, so let me write this up here. Let me write it in purple. Girlfriend, what you say? 99201. What? Say it again, girl, with me. What? She got it. You surprised yourself. You doing good, girl. You're doing good. Okay. All right. Let's see what Mr. Chris got going on over here. What you got? Oh, call him, baby. Call him. He gonna lead you. He'll never lead you wrong.
Yeah,
That's number 42, or what number is that?
Number 48. I think he's sitting up there. Help you this time,
I think he will. Just try. He's merciful.
Well,
just try.
I don't know about this.
Okay.
It says a 38.
Is that number 48 or what number?
Number 40.
Okay.
A 38-year-old female has severe lower back pain due to the trauma injury she experienced at the factory work 4 years ago. The chronic pain has become almost unbearable to her internal medicine physician and cannot go any further with her treatment. An initial outpatient consultant is requested, and the patient is sent to see the pain management specialist for surgery for suggestions to control the chronic pain. The comprehensive history is taken, including all of the patient's information regarding her injury during the comprehensive examination. The patient's gait and movement were observed. Moderate complexity decisions making is performed, including different treatment options. A separate note is dictated to show the requested physician what results were found during the visit and the decision of treatment.
Okay. All right. So I heard you say comprehensive
and
moderate complexity. The 2 variables. Was she a new patient or was she established patient? Okay, so let's look under the established list. So turn it back on the other page. Yeah. Start it over. Yeah, flip it over. There you go. Okay, now let's look at the variables in black. Look at the codes. These are the codes. Established patient. Nope. Established patient. Over here. There you go. Now, we don't see too much of that. Okay? That's 5 minutes. Look at this. Now, problem focus. Is the problem focus? Look at another code underneath it. Is it? Look at the next code. Look at the variables. Look at the variables. Where your fingers at?
Expanded problem focus history.
Okay. Is comprehensive in there?
No.
Is moderate complexity in there?
No.
Turn it over. Look at the next code. Set of codes. Look at the variables.
No. Comprehensive is 99 to 15.
Okay. Do you see a moderate complexity mentioned anywhere in there?
Yes, I do.
You see
I see a high complexity.
A high complexity? Yes. Okay. So high complexity overshadows the moderate.
Okay.
But you did find comprehensive, right?
Yeah, I found comprehensive history, and high complexity.
Okay, very good.
Excuse me. I was looking all back here.
Yeah, it's okay. It's okay. At least you getting to know how to use the book. So what is that code?
99 to 15.
99 to 15.
So what is the difference between this and going back here and going to here?
Uh, okay, I'm glad you asked that question, Chris. Um, what I was doing was showing the basic steps of how to find evaluation management. Now you can go back here and look. Since I was already in that chapter, it was like I was just teaching you how to do the variables.
Oh, okay, got it.
How to look at the variables, okay, for evaluation management. When you go to the other sections that's like for surgery,
Yeah, I got it.
they don't have any variables. They're looked at differently.
We were already inside the chapter.
Right. And evaluation and management, it has variables.
Yeah.
Okay. Everywhere else, surgical, pathology, radiology, they don't have variables. It's just what the reading is.
Okay.
And then it's either add-on code or something else different. Okay. You have to pay attention to the symbols.
Okay.
So, but I'm glad you asked that question. You can go in the back though and then look for comprehensive. So we can do that. So let's do that right quick and then we'll wrap this up. Okay. All right. Now, if you were to go back there, let's suppose that you read your scenario. It didn't outrightly say established, but because what you read, that she has a history, and because of what you read, she's been there before. So that already gave you an idea she's not new to the doctor's office. So you have to really think, okay, she's been here before. Or just like that scenario you read, he hasn't been there before. He's visiting his daughter. He's from out of town. He needs medication. He forgot. Oops. Okay. And that doctor can help him right quick. Okay. So you know by reading that he was what? New patient. Okay. So you have to kind of put everything together and kind of make sense of it all. Okay. And it takes practice. You're not going to be perfect with it. It takes practice. Perfection is done over time. Okay. Let's look at this. So now if you do, let's say, establish patient, so we're going to go under E, and you can still use this in the back, Chris, you can. Okay, E, evaluation, okay. Now you have evaluation and management, critical care, evaluation and management services. Okay, you have evaluation and management services, but let's look for established patient. Okay, there we go. Established patient. Okay, now we have established patient. There it is in the back of this book. We need to look it up, and then you go. It's just like ICD-10. You look up in the alphabetic, you find your code, and then you verify in the tablet section. This is kind of somewhat the same function. This is like volume 2 in the back, volume 1 in the front. It's just opposite, but it's kind of crazy, but you'll get used to it. Okay, so established patient. So it's not a prosthetic or an orthotic patient. It's not a critical care patient. Didn't say anything about that. Didn't say anything about rest home or skilled nursing facility. Didn't say anything about established patient in the emergency room. Evaluation services, basic life or disability. Didn't say that. Didn't say anything about work related. Didn't say anything about home services, home health inpatient, home health outpatient. Observation. It doesn't say anything about established patient, inpatient consultation, or nursing facility. But it does say established patient.
Okay.
I'm in the 2018 CPT book, page 865. 865 in your CPT book, baby. Look like you got it. I'm sorry, my bad. My bad. I'm sorry. Yeah, because I'm looking, I'm like, that look like the ICD. Okay. It's been a long day. I've been working since 9 o'clock. Okay, you see it, baby? I'm on page 865. Do you see that?
I have D.
Hmm?
We're on different books.
No, you're in the right. You're in the right. We'll go all the way to the back to the index.
Oh, green section, baby, green. Is her book like mine?
That's different. I'm on back.
Yours must be 2017.
It is 2017. Thank you. Chris, you just been a saving grace. God bless you, sweetie. He's just been a saving grace.
What are we looking at? Establish?
Establish. So look up the word establish.
Yeah, look up establish. Establishment of establish.
Establish patient.
Establishment.
And then let me know when you found it. And I was like, where's she at? But you're
I was
right.
thinking of hear me. I'm like, wow, I'm thinking.
I
I
know.
have no green in the back.
It's all right, sister. It's all right. You got it, baby.
I got you. Right.
Okay. Now, look all the way down that list. It says emergency department, evaluation services, yada, 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 home services, hospital, inpatient services. I got you. Inpatient consultation, nursing facilities. Now it says office and other outpatient consultations, office visit. It ranges between 99211 and 99215. Do you see that?
So that would be this is an office visit.
It's an office visit, but it's an established office visit.
Okay.
And so now that you found your range, Chris, now you got to go in the evaluation and management section, and then you have to compare your variables. Does it make sense? Does it make sense, Diana? Okay, fantastic. Well, this is going to wrap it up for THCOD. Thank you for tuning in today. And remember, this is the making of a better you for your health information. I'm Mrs. Harper. Have a great evening.